Hi everybody, Dr. Ahles here. In this short video, we're going to talk about the two kinds of physiological buffering systems that your body uses. That's the respiratory buffering system and the renal buffering system. If you haven't already, make sure to go back and watch that video about the chemical buffering systems. Those are the first line of defense that kick in before these two systems. And while these two systems have a bigger effect, it's important to know what's going on with those chemicals before we get to this point. So let's start with the respiratory buffering system. When we talk about the respiratory buffering system, we're talking about the ability of your lungs to change the pH of your blood. The way that the respiratory system can alter your blood pH is by changing how much carbon dioxide is released. And let's underline, highlight, star, carbon dioxide release. Because as we start talking about the way that we can alter pH, it really comes down to, are we releasing a lot or a little carbon dioxide? When a person breathes, their exhalation process releases carbon dioxide. So let's consider first a situation where someone's breathing very quickly. When you're breathing quickly, this decreases the amount of carbon dioxide that is present in your bloodstream. As that carbon dioxide level decreases, this leads the body to need to break down some of the carbonic acid that it has stored because we need to not have this carbon dioxide deficit. If I'm breaking down carbon dioxide, breaking down carbonic acid to make carbon dioxide, ultimately what I end up doing is making my blood more basic. I'm eliminating one of the acids that buffers my blood because I released carbon dioxide. This makes my blood more basic or more alkaline. Now let's look at the opposite situation. Suppose we're breathing more slowly than usual. If a person is breathing more slowly than usual, they're going to see an increase in the amount of carbon dioxide that is present in the bloodstream. As more carbon dioxide is present in the bloodstream, the body's going to start to make more carbonic acid with it. It's shifting toward the right now. And as we make more carbonic acid, we're going to turn the blood more acidic. Our pH is going to drop. So the way that the respiratory buffering system alters pH starts over here on the left side of that bicarbonate buffer with the carbon dioxide. I can release carbon dioxide, I can store carbon dioxide. Depending on what I do with it, I will either become more basic or more acidic. Now let's look at this respiratory buffering system in action. So here's situation number one. The pH in the body has dropped. We're exhibiting what's called acidosis. When we're in a state of acidosis, we have too many hydrogen ions, or parts of our acid, that are circulating in the bloodstream. Our brain and our blood vessel detectors detect this, and they impact respiration. So when our blood becomes too acidic, the brain tells the respiratory system to increase our respiratory rate. As we increase respiration, we're decreasing the amount of carbon dioxide that's present in the bloodstream. And as we decrease carbon dioxide, we have to chop up carbonic acid to replace what we've released. So as I get rid of this carbonic acid, my blood pH begins to rise, and ultimately it'll rise until I reach my homeostasis point, at which point I'm going to slow back down my breathing rate. Now, the opposite could happen as well. Suppose my pH is too high. Now I'm in a state of alkalosis. In alkalosis, I don't have enough hydrogen ions or enough acids in my bloodstream. Again, the same receptors in my brain or my blood vessels would detect this, but this time they're going to tell our lungs to decrease our breathing rate. Because as we decrease the breathing rate, the amount of carbon dioxide in our bloodstream is going to go up. And we have to do something with that carbon dioxide. We have to turn it into carbonic acid. Carbonic acid is something that helps to drop the pH. We drop it back to our normal homeostasis range, and at that point, our respiration rate will go back to normal. So when you're thinking about the respiratory buffer system, remember it's all about carbon dioxide. We either decrease the carbon dioxide in blood or increase the carbon dioxide in blood, and we're going to rely on that shift then in carbonic acid to either increase or decrease those levels, changing my pH. The other physiological buffer system in the body is the renal buffering system. And when we talk about the renal buffering system, what's most important or what's used the most is bicarbonate. So with the respiratory buffering system, carbon dioxide stole the show. That's the way it's going to be here with the renal buffering system related to bicarbonate levels. When we think about how the kidneys are regulating our body pH, it all comes down to increasing or decreasing the amount of bicarbonate that's present in the bloodstream. Now, if you remember, we said that the kidneys create a very large alkaline reserve, meaning we're always going to be reabsorbing more bicarbonate than we're releasing. We always want to have this on standby because remember, metabolism leads to a lot of acid synthesis. So when we talk about the renal buffering system, kidneys are going to increase the amount of bicarbonate in the bloodstream if they need to increase blood pH. Or to put this another way, when we increase blood pH, we become more basic or more alkaline. Remember, bicarbonate is a basic substance, so we'll increase the amount in our blood when we need to be more basic. The way that we increase blood bicarbonate is using an enzyme called carbonic anhydrase. Carbonic anhydrase is an enzyme that's able to take carbon dioxide and water and squeeze them together to make the molecule carbonic acid. We don't care much about carbonic acid, but we care in this right now with our kidneys. But what we care about with this carbonic acid with our kidneys is the fact that we can break that down into bicarbonate. So when we break down carbonic acid into bicarbonate, we can then put that into the bloodstream. And as it goes into the bloodstream, it's going to have the impact of adding something basic. We're going to raise that pH. Now, an interesting thing about carbonic anhydrase is there's two places it can get that carbon dioxide from. Sometimes carbonic anhydrase is going to get that carbon dioxide from urine. So urine had some carbonic acid in it, it broke down, we reabsorbed that carbon dioxide and used it to remake carbonic acid. If that's where our carbon dioxide comes from, we're essentially just reabsorbing or recycling a bicarbonate that we had before. But sometimes when we're talking about carbonic anhydrase building new bicarbonate, it's actually taking carbon dioxide from the bloodstream into the cell, using that to build the new carbonic acid, which will split into bicarbonate. When we use carbon dioxide from the bloodstream, this is actually a way of building completely new bicarbonate. Never in its little life cycle were these carbons part of a bicarbonate. So this new synthesis of bicarbonate is going to help us build that alkaline reserve. If we need to decrease blood pH, so we need to become more acidic, we're still going to use bicarbonate to modulate this activity. What we'll do is we will spit out bicarbonate or decrease the bicarbonates in the blood, put them into the urine, and that will help our pH to drop, to become more acidic. Think about it this way. For every basic molecule, bicarbonate, that we spit out, we're going to have the same kind of effect as absorbing a hydrogen ion. So if I need to drop my pH, if I've suddenly become basic, I'm going to start to get rid of some of those bicarbonate molecules to help me get back to where I need to be. I will mention that it's important to note with the kidneys that they're not very good at a rapid response, but especially because we have that alkaline reserve, the renal buffering system is critical to keeping your blood pH stable overall. So always remember with our renal buffering system, the alkaline reserve. So let's look at our three buffering systems together all at once. When we talk about buffering the body's pH, all of these systems that we've talked about, the chemical system, the respiratory system, the renal system, all of these are working together for the most part to increase our blood pH, to make it more basic. So let's remind ourselves of the way that these buffers work. Remember that our chemical buffers exist to help absorb any hydrogen ions that are in excess. Proteins can do this, bicarbonate can do this, phosphate can do this. So we use the chemical buffer as a sink to hold on to things. We can use the respiratory buffering system to actually release some of that acid in the form of carbon dioxide. That's going to help our pH, again, get higher or become more basic. And when we look at the renal buffering system, there are multiple ways that we use this to increase our blood pH. First, we can build new bicarbonate molecules using that enzyme that we talked about. Then we can release hydrogen ions that come from breaking down carbonic acid to make our bicarbonate. And finally, we also reabsorb the vast majority of the bicarbonate that ends up in our pre-urine. All of these things keep the bicarbonate level high in the body. So as a whole, as you're thinking about buffers, the reason we need to have buffering in the body is because being alive is an acidic process. All of these different mechanisms that we use to buffer the blood ensure that you stay in that normal range, which remember is 7.35 to 7.45.